Virtual reality in healthcare. A detailed exploration of its impact on mental health. Virtual reality is emerging as a transformative tool in the healthcare industry, particularly in the field of mental health. By creating immersive, interactive, and controlled environments, VR allows mental health professionals to treat a range of psychological conditions with greater precision and effectiveness. Conditions such as post-traumatic stress disorder, anxiety, depression, phobias, and even substance use disorders are now being addressed in innovative ways using VR technology. Let's take a closer look at how VR is reshaping mental health care, the therapies it enhances, and the future possibilities it holds for mental well-being. 1. VR in exposure therapy for anxiety and phobias. Exposure therapy is one of the most well-established treatments for anxiety disorders and phobias. The challenge has always been to expose patients to real-world stimuli in a controlled and safe manner. VR is bridging this gap by enabling patients to confront their fears in realistic, yet completely safe, virtual environments. How it works. VR simulates fear-inducing scenarios such as heights, public speaking, or crowded places, allowing patients to gradually face these fears in therapy sessions. The therapist can control the level of exposure, adjusting it in real time based on the patient's comfort level. Example: a patient with a fear of flying can be placed in a VR simulation of an airplane, starting with boarding the plane and progressing through various stages of the flight. This helps them manage and reduce their anxiety over time through repeated, controlled exposure. Why it's effective: patients can confront situations they might avoid in real life, and they can practice coping mechanisms under the guidance of a therapist. Studies have shown that VR-based exposure therapy can result in long-term reductions in anxiety and fear. 2. Treating PTSD with VR-based therapy. PTSD affects millions of people worldwide, especially military veterans, first responders, and trauma survivors. Traditional treatments often rely on talk therapy and cognitive behavioral therapy, but VR is now offering a more immersive and effective approach. VR exposure therapy for PTSD. VR exposure therapy allows patients to revisit traumatic events in a controlled environment. By confronting the source of their trauma in virtual reality, patients can gradually reduce their psychological responses and develop healthier coping mechanisms. Example: a military veteran with PTSD can be placed in a virtual environment resembling the combat zone they experienced. This helps them process the trauma in a safe setting with the guidance of a trained therapist, who can control and adjust the scenario to support their healing process. Impact: VR-based PTSD therapy has shown remarkable success in reducing symptoms and improving the quality of life for patients, especially veterans who may struggle with traditional therapy methods. 3. Virtual reality for cognitive behavioral therapy. CBT is a common treatment for a wide variety of mental health conditions, from depression and anxiety to phobias and addiction. VR enhances CBT by providing real-world scenarios in a virtual setting, allowing patients to practice new behaviors and skills in controlled, lifelike environments. VR-enhanced CBT. VR can simulate social situations, triggering emotional responses in patients with social anxiety or depression. Patients can practice techniques to challenge negative thoughts and behaviors in these simulations before applying them in real-world situations. Example: a patient struggling with social anxiety can engage in a virtual conversation with a simulated crowd, practicing coping mechanisms and learning to manage their stress in a non-threatening way. Outcome: the ability to practice CBT techniques in a virtual setting accelerates progress and helps patients feel more prepared to face real-life situations. It can also provide insights for therapists by allowing them to observe patient responses in real time. 4. Pain management and mental health through VR. Chronic pain is often associated with mental health issues such as depression, anxiety, and stress. VR is now being used as a dual-purpose tool to both manage physical pain and improve mental well-being. How it works. VR distractions like virtual environments or immersive games are used to divert patients' attention away from their pain. This not only reduces the perception of pain but also helps alleviate stress and anxiety associated with chronic pain conditions. Example: patients undergoing painful treatments such as chemotherapy can be immersed in calming virtual environments like a beach or a forest, helping them relax and cope with the discomfort. In mental health, it can reduce the emotional toll of chronic illness. Research has demonstrated that VR can reduce pain by as much as 24%, and its impact on reducing anxiety and depression linked to chronic pain is gaining more attention in clinical settings. 5. VR in addiction recovery and relapse prevention. Addiction treatment is a complex field, and relapse prevention is one of the biggest challenges. VR is now being used to create simulated environments where patients are exposed to scenarios that might trigger cravings or temptations, allowing them to practice coping skills. VR craving management. By simulating environments like bars, parties, or other high-risk scenarios, VR helps patients confront these triggers in a safe, controlled space. Therapists can then guide patients through the process of resisting temptation and developing resilience. Example: a recovering alcoholic can experience a virtual bar scenario in which they are offered a drink. With a therapist present, the patient can practice strategies to decline the offer and avoid relapse. Why it's effective: VR makes it easier for patients to practice refusal and coping skills before facing real-life temptations. The virtual exposure strengthens their ability to resist cravings and stay on track in their recovery journey. 6. Virtual reality for meditation and mindfulness. Stress and anxiety are prevalent in modern society, and mental health professionals are turning to VR as a tool for mindfulness and relaxation practices. VR meditation apps allow users to escape into serene virtual environments and practice deep breathing, mindfulness, and relaxation techniques. Immersive calm. VR can transport users to calming virtual settings like a beach, a peaceful forest, or even outer space. These environments are designed to engage the senses and help users feel fully immersed, enhancing the relaxation experience. Example: a patient dealing with anxiety can use VR to enter a peaceful virtual garden, where they practice guided meditation and focus on calming their mind and body. This can help reduce overall stress levels and promote emotional balance. Impact: VR meditation has been shown to significantly reduce stress and anxiety, providing an effective tool for mental health professionals to incorporate into therapy sessions or for personal use by individuals seeking relaxation. The future of VR in mental health. As VR technology continues to evolve, its potential in the field of mental health is limitless. In the near future, we can expect to see more personalized VR therapy programs tailored to individual patient needs, incorporating artificial intelligence to adjust treatment in real time. Additionally, the accessibility of VR mental health solutions may increase as the cost of VR technology decreases, allowing more patients to benefit from these innovative treatments. Teletherapy and remote care. VR could play a significant role in teletherapy, offering remote patients access to immersive treatment programs from their homes. Customizable VR therapies. With advancements in AI, VR mental health programs could become more adaptive, adjusting the therapy based on real-time feedback from the patient. Global reach. VR could democratize access to mental health care, providing high-quality treatment to underserved populations and regions with limited access to mental health services. Conclusion: virtual reality is a powerful new tool in the treatment of mental health disorders, offering safe, immersive, and highly effective methods for addressing anxiety, PTSD, phobias, and much more. As VR technology continues to advance, its role in the mental health sector will undoubtedly expand, providing mental health professionals with cutting-edge ways to help patients heal and thrive. VR's ability to simulate real-world experiences, offer immersive distractions, and provide controlled exposure to fears makes it a game-changer for the field of mental health. With the promising results already seen in various clinical applications, VR is paving the way for a new era in mental health treatment.